Gallstones, or cholelithiasis, are solid particles that form in the gallbladder, a small organ located beneath the liver. These stones can vary in size and may be as small as a grain of sand or as large as a golf ball. Gallstones can cause symptoms or be asymptomatic silent. Types of gallstones: cholesterol gallstones. The most common type, made primarily of hardened cholesterol. They are usually yellow-green in color. Pigment gallstones, made from bilirubin, the substance derived from the breakdown of red blood cells. These stones are typically small, dark, and can be black or brown. Causes: gallstones form when there is an imbalance in the substances that make up bile. Several factors can contribute to their formation. Excess cholesterol. When there is too much cholesterol in the bile, it can form solid crystals that eventually turn into stones. Excess bilirubin. Conditions that cause excessive bilirubin, such as liver cirrhosis or certain infections, can lead to pigment stones. Inadequate gallbladder emptying. If the gallbladder does not empty properly, bile can become concentrated and form stones. Other risk factors: obesity, increases cholesterol levels and decreases gallbladder emptying. Pregnancy, hormonal changes can affect bile composition and gallbladder function. Rapid weight loss can lead to an imbalance in bile components. Age and gender. Gallstones are more common in women, especially those over 40. Genetics. The family history of gallstones may increase the risk. Symptoms. Gallstones may not always cause symptoms. Then they do. The condition is known as biliary colic or acute cholecystitis. Symptoms include abdominal pain, severe pain in the upper right side of the abdomen or the center of the abdomen, often after eating fatty foods. The pain can last from a few minutes to several hours. Nausea and vomiting. Feeling sick to the stomach or vomiting, especially after eating a fatty meal. Jaundice. Yellowing of the skin and eyes, which occurs if a stone obstructs the bile duct and causes a buildup of bilirubin. Fever and chills. Signs of infection or inflammation, such as acute cholecystitis or cholangitis. Dark urine and pale stools. Changes in stool and urine color can occur if there is a blockage in the bile duct. Diagnosis. Diagnosing gallstones typically involves medical history and physical examination. Discussion of symptoms and physical examination to check for tenderness in the abdomen. Imaging tests. Ultrasound, the most common and effective test for detecting gallstones. CT scan, provides detailed images and can identify complications. MRI, sometimes used for further evaluation of the bile ducts. HITA scan, a radioactive imaging test to evaluate gallbladder function and detect blockages. Endoscopic retrograde cholangiopancreatography (ERCP), a procedure used to visualize the bile ducts and remove stones from the bile ducts if necessary. Treatment. Treatment for gallstones depends on whether they are causing symptoms. Asymptomatic gallstones. If gallstones do not cause symptoms or complications, treatment may not be necessary. Regular monitoring may be recommended. Symptomatic gallstones. Medications. Oral medications to dissolve cholesterol. Gallstones are available but are used less frequently due to limited effectiveness and potential side effects. Surgery. The most common treatment for symptomatic gallstones is laparoscopic cholecystectomy, the minimally invasive procedure to remove the gallbladder. This is often performed when symptoms are severe or recurrent. Endoscopic procedures. For stones in the bile ducts, the RCP can be used to remove stones and relieve obstructions. Lifestyle changes. Diet. Reducing dietary fat and cholesterol may help manage symptoms and prevent the formation of new stones. Weight management. Maintaining a healthy weight can reduce the risk of developing gallstones. Complications. If left untreated, gallstones can lead to complications such as acute cholecystitis, inflammation of the gallbladder caused by a blocked bile duct. Symptoms include severe pain, fever, and nausea. Cholangitis. Infection of the bile ducts that can occur if a stone obstructs the flow of bile. This is a serious condition requiring prompt treatment. Pancreatitis. Inflammation of the pancreas caused by a blocked bile duct affecting pancreatic enzymes. Symptoms include severe abdominal pain, nausea, and vomiting. Gallbladder cancer. Though rare, chronic gallbladder inflammation due to gallstones may increase the risk of gallbladder cancer. Conclusion: gallstones are a common condition that can range from asymptomatic to causing significant symptoms and complications. Diagnosis often involves imaging tests, and treatment varies based on the presence and severity of symptoms. If you experience symptoms of gallstones or have risk factors, consult a healthcare professional for an evaluation and appropriate management options.